Good evening, guys. Yeah, that rally took place here in Ham today. Many taken to the streets, and it ended right here in front of the hospital. The hospital itself was built back in the 20s. It has stood the test of time, but those in charge say change is necessary and will go ahead.
It's been the hospital that our family has gone to for generations.
Christine Calavo has many memories associated with this building. It's where she took her first breath.
I was born at St. Margaret's Hospital in Hammond, Indiana.
And where her father took his last.
He passed away December 30th, 1981, in that hospital.
It's also where she came when her son started clutching his chest in pain as a teenager.
He had what they called a spontaneous pneumothorax, a collapsed lung. The care there was terrific.
But future plans for the facility aren't sitting well with Calavo or many of her neighbours. Hammond's Mayor Thomas McDermott organising this rally today, saying he was blindsided last week by news from the hospital.
They're like, we're going to have an announcement and it may sting a bit. That was what I was told. And we're shutting your hospital down. But you should be happy with 10% that's staying open.
CEO of Franciscan Health Hammond, Patrick Maloney, is adamant they're not closing.
We're not leaving the city. That's the mistruth that's being put out there, is that we're abandoning. We're not.
But downsizing is set to happen. We're told inpatient services are down about 75%. Births have also dropped from thousands a year to about 20 last month.
I estimate we probably are only utilizing about 30% of this building.
So, rather than spend about $80 million to renovate space they say isn't being used, the hospital wants to focus their cash elsewhere.
We plan to invest $50 million into this facility so that it can remain in this community as a vital asset. It will consist of the emergency room, it'll consist of a small 8-bed unit, and we'll have a lot of outpatient services.
And anyone needing additional treatment would then be transferred to other facilities.
They want to find a way to get the other 70% of their hospital occupied. Let's work out a plan together.
But Calumet City's mayor says this plan has a sense of deja vu.
Because they said that same thing about St. James Hospital. They moved St. James Hospital, where I was born, in a black community. They moved it out of Chicago Heights, and they moved it to Olympia Fields. They said that same thing and told that same playbook.
Now, the hospital says the situation with St. James Hospital and Olympia Fields was different because that was a full closure and this isn't. But when the changes are going to take effect here, that's all still up in the air. We did ask about job losses as well. We're told there will be some, but the hospital is working with the staff here to relocate them to other facilities to help minimise those losses. We're live in Hammond. Brona Tumulty, WGN News.